All right. Hello, and welcome to this episode where we're going to talk about 5 things that could really help fix a broken mental health system. And so, in this episode, I want to really go kind of a broader picture here and talk about mental health intervention from a wide scale perspective. For those of you that don't know me, my name is Matt Codde, and I'm a licensed clinical social worker and the founder of Restored Minds. And so, if you're looking for help and guidance on your own journey for mental health, please check out the links in the notes. I have some great resources for you to get started, or you can head over to Restored Minds and connect with me there. And then also, if you enjoy the show, please help us out by liking, subscribing, and leaving a review on iTunes or Spotify. So let's go ahead and dive in. And I want to talk about today the 5 things that we could do to really impact and help our mental health system as a whole. And so this is something that I get asked a lot, or I should say, I shouldn't say asked, I should say I hear talked about a lot, is how our mental health system is not really helping people, or to the level that we want it to, or it's broken, or it's failing people. And I want to challenge this statement to a degree, because the first thing that is at the kind of center of this is that it's the system's responsibility to help people have good mental health. And this idea as a whole needs to be challenged, because that would be like saying that it's the system's responsibility to correct the obesity epidemic. Now, can the system do things to help? Sure. But at the center of everything, when it comes to health and wellness as an individuals, we need to prioritize the individuals as the first level of responsibility, and anything outside of that is then secondary. So when I talk about this, I'm going to talk about this really understanding that there are things we can do at a micro and macro level to impact mental health and mental wellness for a lot of people. But I really want to start with this idea that the system, that I do not believe the system, or any system for that matter, is the primary cause or is primarily responsible for an individual's well-being. I think that's on the responsibility of the individual, and obviously, I think there should be support in place for the individual. And so, but flipping that a little bit, I just wanted to first start with that. So, the first thing that I think that we could do when it comes to and the really the goal of the question is always like, how can we have better mental health as a society? Right. And if we were really answering that question, then I would really want to address it from these kind of 5 levels. And so the first level would just simply be prevention, because and that would involve empowering people with good mental health practices. And what happens with a lot with mental illness is people wait for these very significant times in their life to get help and to get intervention, when really, if we've gotten intervention earlier on, it would be much better, and a much better prognosis, much easier problems to solve. And so a lot of people wait till they're in full-blown crisis to ever seek out help as it is. And this would be much like the person's full-on diabetic, and has gone into a diabetic coma, and we're just seeking medical intervention. At the end of the day, if we're having an issue, the earlier we address it, the better. Okay. And the same thing goes with mental health. We shouldn't wait till crisis to seek change. We should be prioritizing and working at mental health from a preventative standpoint. So we should be teaching things and skills like emotional release, like meditation, like cognitive diffusion, like really learning how to handle fear, learning how to handle anger, learning how to handle guilt and shame, because these emotions are often at the root of a lot of deviant behaviors. Learning about self-worth, all of this stuff. Early on training in primary schools and actually making it part of the curriculum, much like we mandate physical education, really having mental and emotional education and practices as part of the curriculum in schools, I think would embed practices in people's lives that they can carry on, that would have long-lasting effects. And then really teaching them that mental health, like physical health, is a practice. The second, from an individual level, is really equipping people with empowerment and really giving them the responsibility for their own well-being. I think a lot of times we're trying to strip people of their responsibility and disempower people by blaming outside factors. And I think giving people the responsibility and placing it on them, while we think it's hurtful, it's actually helpful, because then they start to look at themselves and work on themselves in ways that are going to help them. Right. So as individuals, it's so important to see ourselves as the primary cause and the primary person who's responsible for us, for ourselves. Having a hard time kind of phrasing the English there. But really, we live in a time where resources are more abundant than they've ever been. And we love to talk about how people don't have access to this and don't have access to that. But really, with the internet, I mean, with podcasts, with YouTube, with books, with digital books now, I mean, it's like the audio books, courses, the resources that are available to people are truly abundant. We live in an abundant time. And a lot of times we're focused on what we don't have access to, and we're blind to what we do. And I think it's so important, if you're struggling with something, whatever that might be, to first seek out people who have conquered or overcome what you're experiencing, and then, see what resources they use, see if they have resources for you. These kind of things, can be totally transformative for people, and oftentimes they're free, they're low cost, and they're available via their phone or the internet, so that they don't have to travel across the world to get help. It's like they can get help like right where they are. And I just think from an individual level, taking responsibility and empowering the individual is going to be very important for the well-being of the masses when it comes to mental health. From a company or workforce standpoint, and this would kind of be the third level. So we talked about prevention, individual, and then from a third level of a company and workplace, really understanding this philosophy that healthy people create healthy companies. And if you have a group of healthy individuals, your company is going to thrive much more than people that are operating in lower states of energy, like fear, like anger, shame, and guilt. And when your employees and team are in higher states, your company is just going to do better as an owner. And so investing in your staff, and this is something obviously like is important to me at Restored Minds, is making sure team is taken care of, right? And that doesn't just mean financially, but we're also talking about like emotionally, right? Psychologically, if they need resources, really seeing that that's something that if I can help provide it, then I try to, and really incorporating benefits into companies and workforce of mental health resources. And that doesn't necessarily mean therapy, but it might mean access to apps or programs with it that people can help learn to regulate their system, meditation, guided, emotional releases, all sorts of things. But benefits that incorporate mental health I think are a very important thing and needed for the future. And leading that into, insurance companies obviously being able to provide more widespread resources as opposed to traditional resources. So, apps, programs, right, that are digital, giving those to people in their networks, I think is going to be, would be very helpful. And so, and then really looking, obviously not from a company and workplace standpoint, not just for output and results, but also really just focusing on individuals and really understanding where individuals are operating from, and really understanding that if individuals are operating from higher states, that generally speaking, they're going to do better. And so that investment is going to pay off over time for the company. Number 4 would be just our overall culture as a society. And I'm speaking specifically more in Western and American culture because we largely prioritize escapism, and we largely prioritize distracting and coping with emotion. So this is why the industries that seem to do the best or some of the highest industries in our society are like the entertainment industry, right? We want to be entertained to distract ourselves, right? Tobacco, alcohol, right? These industries are, the whole sole purpose of them is to help you change your inner state, right? So when you understand that we invest a lot in distracting ourselves from our own internal state of emotions and just kind of everything that's going on in here, when we begin to prioritize health and well-being, we begin to actually see investing in ourselves and our well-being differently. And that's just a whole kind of cultural paradigm shift that I think would be really powerful. And then finally, from a treatment and medical kind of viewpoint, I think the most important thing would be to prioritize interventions that are focused on cause instead of interventions that are focused on symptoms. And, when you look at, let's say, like anxiety, a lot of times first thing is medication, and I'm not speaking out against medication saying that you should never get medicated or go on medication or anything like that, but the efficacy is very questionable when it comes to medication. And there's even studies now showing that the primary benefit of some of the SSRIs could be things like placebo effect, and the numbers are it's not like medication is just guaranteed to work. More importantly, it, if anything, reduces symptomology a bit, but is not a good solution, right? Because essentially the person just has to stay on the medication. So really, what's the cause, right? And really understanding of this idea of stored fear in the body and teaching the person how to actually feel through and release emotion would be a much better treatment intervention than medicating the symptoms of anxiety, in my opinion. And so really, from a treatment and medical intervention level, teaching skills and behavioral interventions that are going to create lasting change, and not trying to just get the person symptom free so that they can go back to work or back to their patterns that often cause this in the first place, is really, again, looking from a whole health model and kind of like, okay, what is the person doing and engaging in on an ongoing basis? What kind of practice do they have? What kind of escapism behaviors do they have? And more importantly, what can they learn and what can we teach that's going to serve them for their lifelong benefit, as opposed to making them feel better just today? And I think those things could really be beneficial and instrumental when it comes to working at a mental health system, or really looking at the mental health system from a bigger picture. So I hope this was helpful. It's just some thoughts that I wanted to share, and obviously, and the last thing would be in that with medical insurance, being that in the United States, you have to have medical insurance, looking for solutions that aren't as traditional, and really, alternative solutions like apps that are being developed, online programs that are being developed, and getting people access to that stuff, or even covering that stuff through insurance. Much like at Restored Minds, we get a lot of questions like that. If insurance would cover this, and insurance companies actually covering digital programs to get resources to people where they are, as opposed to having people have to go to only certain practitioners and network and all that. And it would give people access to resources in their homes, which I think with technology is the biggest benefit that technology is going to bring to mental health, is getting people resources where they are. And so, with that, I hope this was helpful. I hope it was just some food for thought for today. So I wanted to share it. And with that, I hope you guys have a great day, and I'll see you on the next episode. Hey there. So if you enjoyed that video, we've linked up a few more videos that we think you'd find helpful as well. And if you have found this helpful, we'd really appreciate your support by liking and subscribing. And if you're looking for help and guidance, please check out restoredminds.com, as we have several options for you to get started. See you guys soon.